Hey guys, I am going to go over some care plans with you. Concept maps, I mean, actually. Okay, so this is the concept map outline that everybody receives. And then you get a scenario. So let's go over this as an example scenario. The nurse is caring for Mrs. Fuentes, a 44-year-old Hispanic woman who presents to the emergency department with a severe headache. She tells the nurse that she does not speak much English, so a translator is brought to her room. In talking to the patient with the translator, Ms. Fuentes reports that she has had high blood pressure almost her entire life and is taking medication, but has been unable to afford it lately. She lost her health insurance when she was let go from her job 2 months ago and says that all of her money goes to providing for her children. Ms. Fuentes tells the nurse that she often doesn't have enough money to put food on the table. She reports that her husband died right before they were to immigrate from Mexico to the United States. So she made the journey alone with her 3 young children. She explains that she suffers from severe anxiety about her ability to provide for her children on her own. She has been trying to learn English, but it has been having a difficult time and reports feeling as if she does not belong in the community. There are her vital signs. You notice a blood pressure of 205 over 107, a heart rate of 106. Those are abnormal. The provider has ordered as needed labetalol to maintain a systolic blood pressure between 120 and 150. Okay, so now you have all of this information in this little vignette here. So now we're going to put it into the boxes. Okay, so the admitting diagnosis is the medical diagnosis, which is hypertension. In the assessment findings, she has hypertension. She has a language barrier. She's not taking her medication. She can't afford her medication. She doesn't have health insurance. She lacks a support system. She lives in poverty. She cannot afford to feed her children. She has anxiety, and she feels as if she doesn't belong. There were some other things, but those were your main assessment findings that you could create client problems from. So client problem number 1, ineffective health maintenance. That's the problem. How do you describe ineffective health maintenance as the problem? Hypertension, non-compliance, cannot always feed her children or herself. All right, so now we're going to look at interventions. Interventions have to flow from the problem. We're going to do education. We're going to find community support. We're going to inquire about what kind of health insurance, Medicaid, or anything that she might qualify for. So we're going to get her with social services, and we're going to make sure that she could apply maybe for different food banks or food stamps, depending, on her state program. Client problem number 2 is the anxiety. It's proven by hypertension, fear, no sense of community belonging, and you could even put in there patient verbalizes having anxiety. Client problem 2, interventions. We're going to educate, we're going to provide resources, we're going to provide support groups, things that can help her lower her anxiety, because that's our goal. Same with ineffective health maintenance. Our goal is to do interventions that will make effective health maintenance. Client problem 3, readiness for enhanced health management. Okay, so she's thankful for care received in the hospital. She discharged. Okay, those came out of the unfolding, which I didn't read, but that was the last where I had the additional information. She is stated motivation to keep blood pressure under control and find a job. So interventions, discharge teaching, makeup, follow-up appointment check process, help her make follow-up appointments, and teach her how can she evaluate effectiveness of new medications. Now we're going to look at potential client outcomes. Now you're going to need 3, because you need an outcome for each client problem and interventions. So client outcome number 1 will follow a mutually agreed upon health care maintenance plan. The client will demonstrate techniques to control anxiety. The client will verbalize understanding of available financial resources in the community. All of those outcomes are measurable all those outcomes are achievable and they flow directly from the client problem. So when you complete these, I need you guys to really start focusing in on writing a problem statement, and you can use the NANDA guide as like a resource to write a problem statement, because in the NANDA is thousands of different nursing diagnoses that you can put there. You know, risk for skin integrity, risk for, you know, falls, say, like they're all, everything's in that book, or, you know, on like the internet that you can find those problem statements. Also, these interventions and outcomes, you got them from somewhere. You didn't just pull them out of the air. So if you used your textbook, if you used an internet source, you need to cite your resources. You need to start doing scholarly work. I expect it to be in APA format. Try your best at creating some sort of resource at the bottom of this form. You can put it on Microsoft Word if that's easier for you. In Moodle, when you go to this assignment, there is directions on how to complete this. And at the bottom, there are follow-up questions that need to be answered. You can put them on a separate piece of paper. You could put them on Microsoft Word. You can, however you want to submit them, I need those questions addressed and placed somewhere in the PDF that you upload. We're moving into midterm of the course, and I am still, in all of the courses that I'm teaching, I am still saying the same thing over and over again for how to complete these. I made a video at the beginning of the semester, which I don't think anybody watched because the YouTube count is still 0 for that video. So I'm trying to give you all the resources to help you get a 10 out of 10 on these care plans. So if anybody has any additional questions, I grade it weeks 1 and 2 or 3 and 4. They should be in your Moodle. You can look at the comments that I made so that when you complete next week's, you can start making changes so that you can start bringing your grades up.